Gate family, thank you so much for joining us on this edition of MedTech Emerging Minds. And I'm absolutely ecstatic to have Dawn Bitz, the CEO of Adherium, on with us today. Dawn, thanks so much for joining us.
Oh my gosh, always. Thank you for having me.
Yeah, absolutely. Well, Dawn, we've got a chance to get to know each other, and you've had 30 years in MedTech. Most people listening don't know you. Can you give us a little bit of background of Dawn? And then, of course, I want to get a little bit into Adherium and the great stuff you've got going now.
Oh yeah, absolutely. And again, man, we've gone back several years now, so it's great to be sitting in front of you. But yeah, you mentioned I've had roughly 30 years in the predominantly the device industry. I've had an opportunity to work for big companies, and then about 9 years ago, I made the transition into small early stage companies, trying to take that big company knowledge that you get to learn, the experiences you get to drive, and then just layering that in to help, small earlier stage companies, anything from really ideation all the way through to initial commercialization. And really the last roughly 18 years have been predominantly focused in respiratory and critical care medicine. So really excited to have an opportunity to have joined Adherium.
That's incredible. Yeah, and tell us a little bit about Adherium and what drew you to this combination of that respiratory space, and the digital health space.
Yeah, I think that's kind of, it summarizes it, right?
Right.
So, yeah. So, I've been at the helm now of Adherium for really 3 months, which that sounds like it's so much longer than it actually is. I mean, it's been just a little bit over 90 days, just to kind of put it into a day perspective. But what really drew me into joining Adherium was that synergy between respiratory and digital health. And when you take a look at the patients and the problem that Adherium is working to solve. So first and foremost, I think all of us in the device industry know that respiratory is actually a really big disease state, and COPD or asthma emphysema, sort of smoker's cough on one hand, asthma patients who, again, aren't the patients who just need the occasional sort of support and rescue inhalers, but really those moderate to severe asthmatic patients. Both of those combined, I mean, we're talking about 40 million patients alone that suffer from diseases that prevent them from breathing well. And when you think about when you can't breathe, you then have a host of other problems, right? I can't exercise, I can't get on with my day-to-day life. So you get all these comorbidities between diabetes and cardiovascular issues that come out. And you're talking about huge costs to the medical industry, the healthcare economics of respiratory, and it's really one of the top 3 most costly diseases, only really third behind diabetes and cardiovascular. So the problem's huge. The interesting thing, though, is pharmaceutical industries have really done miracles with the drugs, right? So the drugs work, and the drugs work to really manage these patients. But I think as you think about human nature, it's easy when you start to feel better, you kind of quit taking your drugs, you kind of get a little bit lax. I mean, I do it with antibiotics all the time, slap my hand kind of thing. And what Adherium brings is it brings the ability for the device, which actually is, if I can use my cell phone here. So if you think of your cell phone as your inhalers, right, your medication, we actually provide a jacket that just really slips onto the medication, and there's a bunch of sensors in this jacket. So that's the device piece of this. But the digital health piece comes that all that data that's generated, which we can tell when a patient's using their inhalers, how effectively they're using their inhalers, the technique, how much is actually getting into their lungs because of the sophistication of the sensors in this jacket. And we can transmit that into our digital health platform. And what that digital health platform allows is it allows not only the patients to manage and better sort of see how they're doing, but it also gives the providers an inside look in between their care visits. So instead of seeing them at an episodic visit, at one point in time and then not seeing them until they come to the second one, they can actually see what's happening. Yeah. And I've been in respiratory now, a long time, 18 years. And I got hit. I actually was talking with a patient fairly recently who was using the Adherium the platform, the Hailie Smart inhaler sensor on her medications. And she said, I don't realize that I'm getting worse over time because my body kind of compensates for it. So I don't feel worse per se, but it's like the eye doctor. When you go in and the leaves on the trees, you don't realize they've gotten kind of fuzzy until you put your new glasses on, and all of a sudden you see every leaf. She said that's what it's like, is that I don't necessarily know that I'm getting worse until my doctor calls me, because they've actually looked at the data coming through the Adherium platform and said, you aren't doing so well. So let's change your medications. Let's make this adjustment. And she said, all of a sudden I feel much better. And it's like the glasses. So that was a bit of a long way to tell you what attracted me to Adherium is, number one, it's solving the problem of respiratory disease by getting better patient management using their medications. Number two, it's a robust informatics digital health platform that allows real-time, real-world intervention on the patients. And Adherium now today knows exactly what the company is. It knows its identity. It is a respiratory digital health company. And we also know exactly how we are getting into and really monetizing the company and getting into the marketplace. And I can tell you a little bit more about that through the course of the podcast. But it really was sort of this perfect time for me to come in and to say, look at this great company with this great history, with all these learnings, and to be able to say, today is the day, it is now, and let us really exponentially get this technology into the market and serve these patients.
Yeah, I think that's incredible. I mean, you've got 40 million people suffering. There's therapy, the medications you say have worked, that has impact, they know, but if it's not used right, that adherence to medication is absolutely crucial. I mean, that's always the challenge. And having now the ability to have that real world information and real time feedback. I think that story about a physician remotely being able to intervene and improve a patient's life that didn't even know it themselves.
Right? Isn't
powerful? Because your body does adapt. It does.
Yeah. And again, until she said that to me, and you kind of, I've been in respiratory a long time, and you kind of feel like you sort of heard all the perspectives. It hit me like a ton of bricks that, that her story was so impactful and so representative of what's happening. And you talk about adherence. The literature today is abysmal, right? The literature is really supporting about a 20% adherence of patients on their maintenance medications for respiratory management. 20%. And a lot of that data is actually from scripts, from people just picking up their scripts. But we don't know if they've picked up their script and there's been a reason why they haven't used it. I mean, there was a funny episode, I think it was on the TV show House, and the patient was walking in and she had her inhalers, and so she was sort of like squirting it on herself, right? Or just kind of squirting it around. And you get sure that, the patient's going into their doctor's office and they know they're going to get hit with, are you taking your medicine? And then the patient's like, oh yeah, it's almost empty, right?
Yeah, right.
Our data and our technology shows and really demonstrates if the adherence was there.
Yeah, no, that's really powerful. And you're talking about 20% are picking up even the scripts, not how many are actually using it after the fact.
Right,
now, you recently
have data.
You have some, speaking of data, I think you have some pretty powerful data that you just published last couple weeks ago. Can you tell us a little bit more about that change in patient behavior? I'd love to learn.
Yeah. Another reason why what really was an impetus for me to take on and to join Adherium was this data set. So, I think we're here in the United States, we're all really familiar with Intermountain Health and just what a pillar of an institution that Intermountain Health has really, or is really in the industry. We know that their level of care is just top notch. So when you start with a basis of credible and really impactful care to the patient populations, you're starting off with, if we can improve upon that really is a testament. So with Adherium, we actually have a collaboration with Intermountain Health, and together, along with some other partners, they've put together a study called the Eye Care Study. And what the Eye Care Study is it's really a quality improvement study, and it's a real world study. We actually supplied all of our Hailie Smart inhalers. They purchased about 4,000 inhalers for us with intent to put on somewhere between 2,000 and 2,500 patients within this study, real world study. We actually just, to your point, did an interim analysis on the data set. So about 850 patients to date that have actually used the Hailie inhalers really as the engine, the platform to be able to do these interactions with the patient population, and then of course in the Intermountain Health system. And what we demonstrated within the eye care study is an adherence that's pretty profound. So before I tell you what that adherence level is, I got to give you one quick context. Yeah. In the literature, it's pretty clear that a 60% threshold of adherence is actually clinically meaningful. So that's been tied to a reduction of hospitalizations, to emergency room visits, to costs, those kinds of things. So 60% is really the threshold. And what the eye care study demonstrated recently is that patients involved in eye care actually achieved a 67% adherence in COPD patients and a 64% adherence in asthma patients. And again, if you remember that 20%, which is what's in the literature and script data, and this is real, true adherence. And even better, that was sustained over 14 months. So we're talking about patients who actually are using their medications. And I can't steal the thunder of some upcoming additional data sets that are coming out. But if you believe what the literature says, that we should see a reduction in hospitalizations, readmission rates, emergency department visits, and costs, you should look forward to some data that we've got coming out with hopefully some big data sets coming through the ATS meeting here in the spring of next year. So I said this last week. I was actually in Australia talking with some of our investors, and the rare earth elements is a big thing for them. I said, we are sitting on a rare earth elements mine right now of our data set with the eye care and the collaboration with Intermountain Health and others. And this is just what we've shown is just the very tip of the iceberg of what this data is. So super exciting data with a very respected and a partner in Intermountain Health and the others that are continuing to fuel this eye care study. But really the Hailie Smart sensors were the engine that's making this car move, and it's validating to what we have done. So looking forward to sharing that more with our investment community here in the States moving forward.
That's incredible. Yeah, I can imagine as the third most costly disease state, in respiratory, and bringing it from only maybe 20%. That's the ones that pick it up are here, to 67% adherence and 64%. So they're getting therapy, and they're, I mean, I'm sure the data set, especially in a vertically integrated group like, Intermountain Health, is they're going to see, hey, how much does that emergency room visit cost as a vertically integrated, provider carrier, and really see that holistic value bringing to the market, not only the patient, the patients, forget the patient, that's not even counting the patient's impact, and they're, so that's incredible. That's really
better, all those things. And again, that's why I said that this is like a rare earth elements, platinum, whatever the most valuable thing that you can think of and that's relevant to you. We're sitting on that mine right this moment and just continue to mine. And again, remember, continually enrolling. So we've only hit about almost halfway. We're about halfway, pretty close here. We still have another, patient population that we're going to continue to add into this. So the data is going to get more robust. And I didn't even mention that a third of those patients actually hit 80% adherence. So, you're really talking about if the current historical and published literature holds true, again, jaw-dropping reductions in clinically meaningful pieces as well as economic impact, right, in this patient population. So massive opportunity, and again, grateful of where we are and being able to be in the company at this point in time of this data set coming to fruition. And it's just the tip of the iceberg.
That's great. And so right now, where Adherium is, you're commercializing in the United States in parallel, getting this real world evidence that's supporting this. Tell us a little bit about the commercialization path and where you guys are in that process.
And again, I shared a little bit ago in my kind of introduction. So Adherium's been around for a long time, right? And we've had a really trusted investor base in Australia that has really believed in the story and has really supported the company. And, the company, as you can imagine over that history and just sort of figuring out what is the right go-to-market strategy and what is the right business model and all of those things. And there's been ebbs and flows for the company. But I would say really over the last kind of roughly, 16 months or so, it began a little bit into last year. The company really, before my time, understood the value, number one, of the US market opportunity in that we've got really favorable reimbursement here for remote patient monitoring, or existing CPT codes for both monitoring as well as therapy. And sort of the environment in the United States really became conducive to tripling down, not even doubling down, but really putting the US front and center from a commercial standpoint. So, back about that 18 months ago, 18 months ago, roughly speaking, it might've been a little bit more or less than that. They were able, Adherium, prior to my arrival, was able to get alignment with some national groups in the allergy space. Allergy Partners is one of the largest health consortium of allergy clinics in the United States. CENTA is another one. There's a GPO organization in that space called CIIC, and Adherium was able to negotiate those contracts. But I think the big piece of learning came really this summertime when Adherium and the some of the folks that have really been guiding the board understood the value of setting up an infrastructure here in the United States to support Adherium actually owning the business model of the remote patient monitoring. And what that gives Adherium today is a mechanism to drive recurring revenue through fee for service, leveraging those CPT codes. So basically around the July, August, June, July, May, June, July timeframe, we really doubled down on let's put this infrastructure in place in the United States. And I was able to join kind of end of July, and really to reinforce, and we're really investing in that infrastructure. So what does that mean? That means that we have set up our own call center. We have set up our own infrastructure to support, an RPM business. So we take all of the patients through our partnerships with Allergy Partners and CENTA. We make sure that those patient lists go through an insurance verification to make sure they've got the right insurance to support. And then our call center is actively going through those lists right now with tremendous success, and getting patients actually to get on board with our technology. And then we've got the infrastructure in place to then, generate revenue through fee for service and utilizing those CPT codes to make a sustainable business for the company. But that's just the tip of the iceberg. I'll get to that point in just a second. When I came on board, we're talking about kind of like a few hundred patients that had gotten on our technology. Really, as of about this week, we're over 1,000 patients that we've shipped our devices to, and that are onboarding and getting onto our technology. To give you just a couple of weeks snapshot, not last week, but the week before, we had 117 shipments of our devices out to our patients. Last week, we did 153 patients. This week, we're targeting about 175 patients. So as you can imagine, that uptick, we are right on the acceleration of getting patients into this business model. We've got a goal of 10,000 patients by December of 2026. We're going to try to, of course, work our magic to beat that, but that's what we've communicated. And again, that's a meaningful business for us, just the RPM. But I mentioned just the first step.
Yeah. No, that's great. And that allows you to be able to control that destiny, control that patient experience, because every institution is going to treat RPM, how it's monitored, and you can really create that path, take all those friction pieces out of the way to be able to make it simple to not only provide a good commercial and financial revenue model for you, but also ease of access for patients, right?
And you hit the nail on the head, right? Adhering, being able to control our own destiny. And that's what we've doubled down on over the course of the summer, and me being able to come in and really just drive that destiny moving forward. Because what RPM does for us today is it creates a sustainable business today in this RPM model. But what it gets us to is what I alluded to in the second step. Because again, now when we talk about payers and we talk about that very costly disease, this very costly disease of respiratory, and the fact that there is no other really solution to being able to affect that the economics of respiratory in the way that Adherium can. Now you get payers. So what does a payer want to create a value-based payer program that can actually reduce their costs? Number one, they need data. Well, we just talked about earlier, the data set that we've got in collaboration with Intermountain Health,
right,
and the economic story that you're going to see. The second piece is they want the right infrastructure to support a value-based payer program that is going to reduce costs for these, Cignas and the United Healthcares of the world. And we are building that, and we're testing it, and we're driving it, and we're refining it through this RPM business model, including platform to, again, support the digital health side. And then they want demonstrable results. Well, I alluded to the fact that we're driving to 10,000 patients. And again, we're on that trajectory. We'll get a little further down that trajectory. Now we've got a really compelling story to take back to the payers and to say, look, payers, we are your definitive respiratory digital health solution to drive costs out of this very costly disease. Yeah. We're already having some of those conversations with a few notable payers today to set the stage. Now, again, we're just making sure that we have all of our I's dotted and T's crossed so that, in a just really short order, we can go back to those payers, be able to then get a contract and deliver on that contract. And that is the next big inflection point. And some other companies in other spaces like diabetes and cardiovascular have done that. They've gotten a couple of payers on, they've gotten these value-based payer programs. And one, went public back in June at $1 billion valuation. So that's the playbook that we're following.
No, that makes total sense, because you get that evidence, you're able to show adoption, you're able to show value, and now instead of just getting a contract, you're getting steerage, you're getting support, you're getting direction from those payers that are looking for those cost savings, and better outcomes that they promised.
And you're talking about 100,000 patients between Allergy Partners Group and again, in a fee-for-service model, which has a higher human resource need to support. Mm-hmm. But you're talking about millions of patients in the payer opportunity, and through a value-based payer program, not only makes our ability to manage it much more economical, but the margin opportunity that we can get on a monthly per patient per use fee in that model is far greater than what we can do in an RPM. So RPM is great today. We are building the business model, but we're using it as a proof opportunity to then get to really what the next and the biggest golden opportunity is, which is partnering with payers.
Yeah, that's great. That's great. And so do you see Adherium and the Hailie platform being eventually the standard of care when it comes to inhaler delivery?
Of course. But no, I mean, to make that more than just kind of a thinly sort of supported statement, right? First and foremost, we know medications work. So we just need to get the patients, and we need to get them in a way to be compliant and adherent with their medications. And Adherium today, after all the time that's been in existence, and it's seen competitors come and go, because look, it's not an easy business model to figure out, but we figured it out. That we figured out the business model. Number one. Number two, we're in an environment kind of post-COVID where there is such a support for digital health and reimbursement opportunities in the digital health space. And we also know that, again, COVID and sort of the experience to this point, that it's just reinforced that respiratory is not going away. And if anything, it's going to get worse, and it's very, very costly. So in so many ways, I'm biased. I think we are the perfect storm for all the reasons that we've discussed to be the standard of care, and for Adherium to drive the standard of care within this space from an adherence standpoint and really a stickiness over time to keep these patients out of the hospital, to keep them out of the emergency department, because both of those we know drive up costs. And again, we're seeing that in the eye care data set, which is the first of its kind. It's a real world data set, and it's the largest data set, and it will of course then be far larger than that when we're completed, of any respiratory research that's been done. Typically it's 20 to 50 patients, and we are talking about 800. So kind of perfect storm.
Thousands to come.
Yeah. Wow.
That's great. Now I'm going to shift gears a little bit. Obviously, as you grow,
yeah,
company has got great products, but it means nothing without the right culture and people. You've been at a few startups.
Yeah.
Tell me, how are you going to build the culture? How do you build cultures that, that can scale and grow?
Yeah. So I think it starts with just, amazing, profoundly capable talent, right? And so again, I am very honored to have inherited some amazing talent within the organization today. So we're starting with a great basis of talent, right? We're going to continue to elevate and escalate that talent as we continue to move forward. The ability to generate revenue, and of course our ongoing investors and investment, of course, help us to accelerate that. Partnering with, Floodgate is also a big piece of this, to get that talent in. So that's kind of number one. Number two is then fostering that talent and creating an environment of problem solving and of entrepreneurship in the organization, right? Mm-hmm. We are a small, company. We need to continue to be nimble. We need every person within the organization to continue to solve those problems and to come up with really creative, dynamic solutions. And I think that's a theme across all small companies, right? You got to continue to have that small company mindset. And then the third piece that I think of, right? So great talent, enabling that great talent, and then maintaining a patient-first mindset and a problem-first mindset. We need to solve the problems for the payers. We need to solve the problems for the physicians, but most importantly, we need to solve the problems for our patients. We can save lives. We can get people a better quality of life because, again, we know the medications work. And we know human nature, you feel better, you kind of get a little lax. So how can we then take, not without changing their behavior, and give them a solution that actually enables them to feel better, but feel better all the time. And when we have those perfect three things and we're focused on those three things, I believe great culture results.
Yeah. Have the right people, give them the right empowerment with the right why, that they stay focused with their North Star. Right. I love that. That's a perfect three things to keep that flywheel of growth going and accelerating.
Yes.
Well, I'm with you. I think this is absolutely an exciting opportunity, way it can impact those 40 million people, where you're positioned, and you do have that perfect storm of need, reimbursement, and digital connection that, didn't exist 5-6 years ago, wasn't available. Yeah. Now it is. And so now is the right time for Adherium. For those who are listening and want to learn more about, the company, invest in the company, the solution, how should they connect with you? What's the best way?
Well, of course, they can always reach out to me directly, and you can include my contact information, my email especially. But and then of course we can get them to whoever's the right solution. So if they've got a question about the product, probably not the best person to answer the product question. We've got amazing team members, like I said earlier, to be able to connect with. But really, where does a company like us need to continue to double down is really here in the U.S., the investment community, and really building that ongoing support. Because again, for us to get to the next level, we need our investors, we need our partners on the investment side. And, again, I'm a little biased, but I'm only 9 months biased, right? The reasons why I joined are the reasons that you just reinforced, which are also the reasons why, this, is a place to double down on investment, right? And I think we're the right company to be able to support that. So I would, of course, love to continue those dialogues and demonstrate why I believe that to be the case.
Incredible. Dawn, thank you so much for joining this episode of MedTech Emerging Minds. This definitely is some emerging MedTech that's going to have impact. And you're an incredible mind to tell the story. So thank you so much for taking the time.
Thanks for having me, always.